Hello, everyone, and welcome. Thank you so much for joining us today. For those who are very new, my name is Devi Sambamurthy, and I'm one of the co-founders of Hold Forum for Women. Before we dive into today's topic, I want to take a few minutes to share what Hold is all about, and more importantly, why it exists. Hold was born on International Women's Day, 8 March 2022. Four of us, Vasu, Bhairavi, and Anjali and Devi, were together part of it. That's the script Vasu has given us, but honestly, it is Vasu's brainchild. She keeps telling it's Vasu, all of us, but it is she who started this, and we all felt very privileged to be part of this movement. Generally, our mothers, our sisters, our friends, we notice something. So many of them were dealing with all sorts of health issues like aches, fatigues, mood changes, infection. And when we would ask about it, the answer was always the same. It's just part of life. That phrase kept coming up. And we realized that that's not good enough. Just because something is common doesn't mean that it should be suffered through in silence. And that realization is the heart of Hold. What we do here is bring into limelight topics that are usually difficult to talk about, the things women experience but don't discuss. Not at the dinner table, not with friends, sometimes not even with their doctors. Whether it is menopause, hormonal changes, mental health during different life stages, hair loss, headaches, we go there. We create a safe, supportive space where no topic is too awkward, too embarrassing, or too small to discuss. Our mission is very simple. We want women to come together, share their experience with hormonal health changes at every stage of life, learn from each other, and learn from experts. We believe that when women talk openly, two powerful things happen. First, you realize you're not alone. And second, you get the information you need to actually do something about it. Over the past 4 years, we have held sessions of everything from perimenopause to nutrition, from emotional well-being to hair loss. We had incredible doctors and specialists joining us, and the feedback that moves us the most is when someone says, I didn't even know this was a thing. I thought it was just me. That moment of recognition and validation, that's what Hold is for. And that brings perfectly to today's session. Let's talk bladder health. This is exactly the kind of topic I'm talking about. UTIs, bladder issues, how many of us have dealt with it? Not talked about it, felt embarrassed. Google symptoms at 2 a.m. Nowadays, ChatGPT. Instead of asking someone, you're not alone and you shouldn't have it figured out by yourself. Today, we have an expert joining us and talk about what every woman should know about the bladder health, awareness, prevention, and then when to seek help. So let's do what Hold does best. Let's break the silence, get informed, and support each other. Welcome to Hold. Let's get started. So what's going to happen today. So I'll invite Bhairavi, who will be introducing the guest, and Vasu will be having a Q&A with the guest, and then followed by a Q&A with the audience.
Thank you so much, Devi. Thank you. Let me introduce you to our Dr. Usha Kiran. Dr. Usha Kiran is a consultant OBGY and one of the top gynecological laparoscopic surgeons in the UAE, practicing at Prime Hospital, Meteor Hospital, Emirates Specialty Hospital, NMC, and Burjil Hospital. Coming from a small town in Karnataka, Dr. Usha gives the credit for her success to her father, who believed that education was the single most powerful tool to empower his daughters. She started her medical studies in Mysore University, then in Mumbai University and in UK. She has done advanced laparoscopic hysteroscopic surgery in the UK and went to become a consultant gynecologist and unit head at the Cardiff University of Wales. She has an award from the Royal College of Obstetricians and Gynecologists for her contribution in this field. Dr. Usha has many firsts to her name. She is the first to have introduced scarless surgery in the whole of UAE. She also has removed 128 fibroids from a single woman, largest number in the UAE. She's the first surgeon to have operated on a woman weighing 140 kgs and removed the largest cyst laparoscopically in the world. Dr. Usha Kiran also holds a world record for being the oldest woman to have climbed Manasalu in Nepal. Mind you, slightly less than Mount Everest. Last but not the least, Dr. Usha Kiran is the founder of Woman Nari, a NGO with a mission of empowering women with health and strength and healthcare and training to the doorsteps. As a part of this initiative, she regularly conducts free surgical camps in Kargil, the war affected area in Cuttack region, and Robertganj in Uttar Pradesh. Dr. Usha Kiran is also a dear friend, has always supported Whole Forum for Women. In fact, she was our first guest on this platform 4 years back. She's our in-house specialist.
Hi, Usha.
Hi.
There is one line which I stopped my dear friend Bhairavi to say from. She said that this is I can go on and on about Usha. And I said, don't say that. It's okay. You just read whatever it can be. In your time is 5 minutes. Otherwise, we'll have to have just to speak about you for 50 minutes. So
Thank you.
sorry that we didn't cover many of your achievements, great
No, not at all.
achievements.
Not at all.
And
Some of them, even the one you covered, I have actually forgotten.
no, we are so proud of you, Usha.
Thank you. Thank you.
Empowered. We feel empowered around you. We feel
Thank you.
whenever is living in UAE, you need a gynac, and your gynac friend is so important. I think, and I think in whole forum we have found you that, and much before also. So I'm very happy to invite you to this forum. We are very happy to invite you to this forum. Yeah.
And thank
So,
you. Can I just say something? Yeah,
yes,
thank
please.
you very much, Devi, Bhairavi, and Vasu. Thank you, Bhairavi, for the introduction. Like I said, I've forgotten some of the things that you mentioned that I've achieved actually. I'm getting old. I turned 60 this year. So I couldn't believe it when Devi said 2022 this was started, and I remember I was the first speaker. So it's been 4 years. And I'm really impressed with you guys to have continued this with persistence and giving out information to the women, which is very, very useful. Congratulations to all of you.
Thank you, Usha. You are one of those who have always supported us and encouraged us to do what we are doing today. So really happy that you are here again with us. And as Devi said, it's a very important topic today, so I won't waste more time. Uh, you know, uh, we'll go ahead with the questions. Okay. Bladder is somewhere on the same area. It's in the same ground as pelvic, the um, our whole, and I think menstrual health and everything is in that same area. So I think bladder is a very important part of women's, not only just women's, men's also, because I do know UTI and things like that happens to men too. So shall we start by understanding from you how much importance we need to give bladder health, and then probably you can also tell us how to take care of it, and then we can finish it with by more understanding how to prevent things like UTI or anything like there is a words that are medical words which I probably won't be able to pronounce it, but you may use it and make us understand, because when you laugh or when you speak quickly or when you're doing something, you also leak a little bit. All those things we want to understand, whether that's natural, whether it has to be something that we have to look into. So shall we start with what
Yeah.
is bladder health?
Yeah. So
Okay.
before we go actually into the bladder health, Vasu, I want to take up on what you said about men, women inclusive to have bladder issues. There, I think we are slightly different. I wouldn't say slightly; we are quite different to men because the amount, like you said, the bladder is being supported by the pelvic floor, and the amount of onslaught. To put it in Hindi, I would say जुल्म जितना होता है हमारे pelvic floor पे है उतना जुल्म मर्दों के ऊपर नहीं होती है.
Okay.
Okay, so the child, from the childbirth to the hormones and everything, kind
Oh,
of really are dynamically affecting our pelvic floor and hence the bladder health and position and anatomy and functioning throughout our lives. So
okay.
if you talk about man's bladder, it probably is almost the same from the beginning till the end. Maybe towards the,
True.
towards 60s and 70s, maybe there is slight change because of the
Hmm.
prostate.
Hmm.
But however, women's bladder starts from when you're a teenager to when you start having your periods, it kind of undergoes certain changes. When you get
Yes.
pregnant, it undergoes changes. Then you deliver, then it undergoes changes. Then comes your menopause. So constantly we are being, bombarded with something or the other on this bladder, which keeps bladder health as the foremost for every woman. Now, I can confidently say that I don't think there is a single woman in this whole wide universe who hasn't had a bladder problem, one thing or the
Hmm.
other. Everybody at some time would have had some issue with the bladder. And like you said previously, many women go through with these things thinking, sabhi ko hota hai. I mean, it's the norm of life. It is
Hmm.
not the norm. When we talk about, like Devi was saying, we don't have to tolerate this in silence just because it is common. So disease is itself, it's the dis with the ease. So
Yes.
anything that makes you uncomfortable, anything that takes away the ease from you, it requires attention. Now, whether it requires attention in terms of habit changes, lifestyle changes, whether it is to do with home remedies or to see a medical personnel, that does not matter, but it requires changes. So coming to the bladder itself, you can come across, it is basically sitting supported by the vagina
Hmm.
at its base. So
True.
whatever happens to the vagina, so it comes into picture in terms of your when you're having intercourse, various things. Okay,
Yes.
so it's very important that from the beginning, if we are aware of it, more than keeping your bladder health in good status, being aware what constitutes as bad bladder health. Okay, before
Hmm.
going to even bladder health, I would say what are the bad habits which will lead to bad bladder health.
Okay.
Commonly these days, commonly, because most of us women now are working women, so we are constantly busy rushing from one place to another. If for example, if you take me, I'm seeing patients, I'm doing surgeries. So somewhere along the line, because you're so busy doing your things and you're so engrossed in doing, you
Hmm.
tend to forget to go to empty your bladder more often.
Hmm. So
If
true.
you're at home, yeah, if you're at home, I suppose you would, the moment you feel like passing urine, you would just go to the toilet and do it. But
Hmm.
the same thing at work, you want to pass urine, you're like, let me just finish off this note, let me just finish off this patient, let me just finish off, submitting this work, whatever it is you're doing. So you generally tend to put it off. So the bladder being distended constantly, to some extent, it's okay. It is an elastic organ. But if you're constantly leaving the urine to stay there, that is one of the things that can actually give rise to infections and various other things and
Oh,
discomfort.
okay.
So so I would suggest to all women, please make sure the moment you get an urge to pee, find a toilet.
Okay.
I'm not saying that you become one of those people, पाँच मिनट में भाग रहे toilet पे, वैसा नहीं. But at least, think of it, okay, fine, I want to pee now, and I definitely want to do it. So let me go to the bathroom, finish the work later on. So that's what you need to be looking at. The
Okay.
second, the
Noted.
second most important, yeah, the second most important, most of us, again, basically because of the main reason that we are busy and we're occupied with other things, we don't tend to drink enough water. And that includes me.
Hmm.
So less water makes the urine more acidic. It irritates the bladder more.
Hmm.
You may not realize that what's happening to your bladder mucosa is a very thin lining. So
Hmm.
let's imagine you put something which is really burning
Hmm.
into your mouth, and
Hmm.
leave it there without either swallowing it or spitting it out. After
Hmm.
some time you'll find that the mucosa of your mouth is all burnt.
Yes.
So the
Yeah.
same thing. So imagine your bladder holding on to something which is more acidic, which keeps
Yeah.
on, irritating the bladder. So the bladder mucosa can get abraded, and that
Hmm.
becomes, irritable. So you can get burning, you can get bladder muscle irritability. So you're basically causing discomfort to the bladder, which in turn will cause discomfort to you.
So
So
that means
drinking,
the toxic needs to be flushed out. That means you need to drink more water. Are you saying that, right?
yes, yes.
Because
So
we all like the word detox, but we have a
yeah,
natural detox, which is our
yeah.
bladder, isn't it?
Yes,
Yeah.
yes, yes, I
Yeah.
agree with you.
Yeah.
So, so we don't drink enough water because we don't have time to drink, and
Hmm.
we don't pass enough number of times urine. And these two are complementary to each other to leading to bladder health. Reason being, we are busy, so we don't want to go to the loo often, so we drink less.
Hmm.
You kind of, if I drink too much, I might have to go on and on, again and
On and
again.
off.
So
Yeah. I've
yeah.
done it all my life. Yeah.
Yeah, so you tend to kind of not drink enough, which in turn
Correct.
is damaging your bladder mucosa.
Oh.
This does not really come into picture so much so when you're in your teenage, or when you're in your 20s and 30s, probably,
Yeah.
because like anything else in the body, your tissues are very, very healthy. They have a lot of potential. They're less prone to damage. They're very good at repairing things. But as you grow older, these habits which you have been inculcating for the last 20, 30 years, when you reach around 50s, you start realizing your bladder is no more as young as it used to be. It doesn't repair very well. It doesn't tolerate things very well, because
Yeah.
become more delicate. So then you start getting symptoms, and then people are looking for solutions.
Correct. But the damage is already done.
Yeah, damage is ongoing, and the habits
Yeah.
which more than the damage itself, the habit which has become a part of you is now
Hmm.
a big thing that is so difficult to get rid of it.
Yeah. I also liked what you said that enough water. You didn't specify 8 glass and 10 glass because
Yeah,
I'm saying this because when I drink too much water, I actually feel sick. So I have
yeah,
learned to listen to my thirst now. So I
yeah,
like the word where you emphasized, and I was listening 2, 3 times. You said enough water, enough water.
yeah,
So,
yeah.
do you also believe that you have to just
Yes,
listen to how much you need and
yes,
drink?
yes. Yeah, so basically, nowadays there is this everything becomes a fad. Drinking water becomes a fad. You've got to
Yeah.
drink 2 liters of water. You've got to drink 3 liters of water, and so the body has a very inbuilt mechanism as to how much it requires, and it tends to give you a feedback all the time.
Hmm.
I do agree that we do have AC these days, and we are not rushing out in the sun and sweating. So
Yeah.
you probably don't feel that thirsty. So you now have to change your perception what thirst means. Let's say
Hmm.
now, just because you're in AC the whole day you haven't drunk water, you can't stay like that. You do feel like in between you feel like you want to go and grab a cup of water.
Hmm.
So that's a very subtle feeling of thirst, and that keeps coming every few hours or in every hour or so. So instead of drinking a lot of water at one time, like drinking a liter of water or something like that, what I suggest to people, or what I personally myself do, is that I just remember to drink water every now and then,
Hmm.
so that I don't forget, if I'm busy. So I generally do. I get up in the morning, I have a glass of water, then I have my coffee, and before I kind of finish, I mean, after I finish showering and I'm ready to go to work, then I have a large glass of water. Then I get to work, and then before I start my OT, I have a glass of water, and after every case, I have a glass of water. So
Okay.
I feel the body is using up that amount anyway, a glass of water, for the
Hmm.
metabolism and everything else. And so you feel like every few hours you want to go and pee. So instead of drinking 2 liters at a go or a 1 liter at a go and then just pushing it out all and then the rest of the day saying that I've drunk my 2 liters or 3 liters, that isn't enough. The tissues require a constant hydration. So
Yeah.
you need to kind of space it out and drink, and don't count how many glasses you drank. If you
Yeah.
feel like the
Yes.
next glass of water you don't want to drink it, don't drink it. If you feel sick, you
Mm.
don't drink it. If you
Mm.
feel like I want to drink water and if it feels good drinking that glass of water, just drink it. So
Yeah.
body gives you a good feedback. We tend to sometimes not listen to the feedback.
That's true. What about coffee and tea? Does it affect bladder health?
Yes, coffee and tea, nothing, even poison doesn't affect anything in the body if it's taken in small doses.
Correct. Yeah.
So when we say coffee and
Well
tea,
said.
again, if you're having a cup of coffee and you've had all your life a cup of coffee or 2 cups of coffee, it doesn't really make difference because the body is used to
Uh,
that cup of coffee and it's compensating by drinking an extra glass of water
mm,
to compensate for that coffee, which will bring out more urine. So most of these drinks will actually make you urinate more.
mm.
They make you dehydrate in the end. So
Okay.
if you're drinking 10 cups of coffee, that can actually make you very dehydrated if you don't supplement the 10 cup with a lot of water to
Mm.
compensate for the dehydration. So coffee and tea, yes, in moderation, should not really make a difference.
Okay.